One of the interns was playing this game that she had learned from China with some of the kids, and I was there and just playing with them and seeing them smile and be happy, especially in the time that we live in right now. That really struck me, and it really showed me that this is the community that I want to work with. RISSE is the Refugee and Immigrant Support Services at Emmaus. The main mission is to help newcomer families with any challenges that they may be facing in terms of learning the English language or even sometimes with immigration, to give them that support system that they really need.
We help connect people to food pantries and provide baby clothes and diapers when needed, car seats, connections to other services in the area. It really is a tight-knit and amazing community.
One of the teachers told me about this woman and how she was a refugee from Rohingya, and the only language that she spoke was Bengali. And so I got to use my language skills, and when I first went into that English class, I told them that when my family first emigrated from Bangladesh, my mom was in a similar English class. And it really showed me how important it is to know a different language and be immersed in that culture.
My main project right now is working on a community health needs assessment, looking at how RISE is addressing these needs. Who are our clients? Do they need to know the insurance better? Or are they having trouble even just finding a doctor, a primary care doctor, an emergency doctor that we'll send out to our community, and from there be able to create interventions, events, educational aspects that will be able to address what our population needs.
I realized that I wanted to do something in health education, and that's when I started to pursue my MPH. Each experience that I have at RISE or a local health department that I work in really reassures me that I'm on the right path.
The internship component of the MPH is so key. It really provides a well-rounded experience to the field of global health and social behavioral health. UAlbany and the College of Integrated Health Sciences have been so wonderful in facilitating that, and I'm very grateful to have a very strong foundation moving forward.